Stephen, tell me about the current healthcare system and the situation that we're in.
Sure. Um, so for context, I'm going to talk about the business side of healthcare because that's what I'm familiar with.
Mhm.
And you can't really go far in talking about healthcare in the United States without talking something called fee for service. Fee for service is exactly like any other business that you would imagine. Is there's a service and there's a fee that goes along with it, and that's how the hospital is paid. And so that differs from a lot of models that are in other countries that are called value-based medicine. And part of the hospital's compensation in value-based medicine is they're assessed on the outcome of the patient. Currently today in the United States, fee for service does not incentivize a healthy outcome. Now it's evolving. It's not as strict as it was maybe 10 years ago. Um, but for now, you get a surgery, there's a set cost that an insurer will pay for that service, and that's what it is. There's not like a complex, well, it is complex, but simply put, fee for service is actually a great definition for it. There's a fee for a service. And so you can go a lot of different directions talking about this, how it's not a good thing, how it is a good thing, how it's going to be really hard to change, etc. Um, so yeah, that is the basic framework of how you can understand how hospitals are paid.
Okay, so that's kind of where, your, if you want to call it an expertise, lies. And so, why is, if you know, our country set up this way and others aren't?
Well, I think the United States in general has a pretty individualistic, independent view on life. And other countries, like maybe the UK, Canada, or South American countries, really anybody other than the United States, has a less individualistic view on it. So, say in Canada or in the UK, they have a lot of this is where it gets tricky, but they have a government sponsored healthcare system.
Mhm.
And I don't know if you've noticed, especially in the past couple of years, Americans generally don't like the government meddling in their personal lives. And
Not our
so
favorite thing.
I think, no, and it's been that way for a while. And so I think when um, private health insurance came in to the United States, which actually, funny enough, the first private insurer was Blue Cross Blue Shield of Texas in Dallas. Um, so that's pretty interesting. And for the people who listen to me, you can fact check me, but I believe it was in 1950. I could be wrong about that. So fact check me. Comment down below.
But surely
No, but
sometime in like the late 40s, early 50s, I would guess.
it's post World War II.
Mhm.
So somewhere in there, and that's when you really start to see privatized, like real privatized insurance, health insurance, and that's when things get wonky because they're so well established that they're going to be really hard to move. But current events, United Healthcare is not doing so well. So it's been pretty interesting to watch that. I think their stock is down like 50% over the past like month. So
50%?
yeah, they've been under investigation for a while. I believe the first investigation came, the big one was antitrust because okay, health insurance companies are very vertically integrated. So you'll have an insurer who also owns the doctors, who also pays their own claims. So
Hmm.
United Healthcare is the parent company, which owns Optum. Optum is a physician network that sees patients, and they're oftentimes seeing United patients because United is huge,
Mhm.
and they're always in network. and then that claim will be sent to United to pay. And so it's very confusing, in my mind, how that's okay. Um, and fun fact, uh, last year there was a cyber attack on Change Healthcare, which, surprise, surprise, owned by United,
Mm.
um, was the largest clearinghouse in the US, which processed all the transactions for most major health systems.
Is that what a
And so
clearinghouse
there,
is?
yeah,
Okay.
it's basically it's just a bunch of people pushing paper, for lack of a better term. They do some other things like analytics and stuff, but to understand it, it's just like a processing center. And so United was processing their own claims through Change Healthcare. They are also processing most of the US's claims, hospital claims through Change Healthcare. And that was hacked, got shut down, several months of no payments processing. So it was a big deal. So that was also another big hit to United.
Wow. They lost
But
a
I rambled
CEO
a little
recently.
bit. They did, and they yesterday, the CEO of the parent company stepped down. So you never know. Maybe this is when value-based care can get its foothold.
Wow. That's okay. So, do you think that the this seeming downfall, if you will, of United recently, how related to the fee for service versus value based care do you think that is versus just poor financial decision after poor financial decision on a like systemic level in the company?
I don't really think that. Well, based on what I know, um, I don't think it had as much to do about fee for service as it does them being so vertically integrated. So, when one piece of the chain breaks, there's cascading effects. And I know that I briefly read a Wall Street Journal article that was talking about that they were under investigation for Medicare fraud, which is a big deal. So I don't know how much it had to do with an actual like financial structure, more of just like maybe poor operational decisions
Hmm.
for a prolonged period of time.
Gotcha. And then, like you were saying, if they're under investigation for a myriad of things, especially antitrust, that could make sense. So, how do you
There's
see
a couple going on.
a couple investigations?
A couple, yeah,
Oh, goodness. So, how do you
yeah.
see value based care being able to maybe, like you said, take a foothold in the wake of these kinds of things happening? It seems like to me, an increasing number of Americans are dissatisfied with the type of care they're receiving and particularly the
Hmm.
cost of that care. And so, there's obviously some concessions to be made. It's from what I understand on cost, but talk to me about how that relates and how maybe there could be a change coming, if at all.
Yeah, I don't know how much I can speak to if there's a change coming, because I think there's going to have to be a lot of federal regulations that come into place,
Sure.
um, that break up some of the private health insurers. Because right now, they're in hospitals are incentivized to do as many surgeries as possible because that's what's going to get reimbursed. When you go into a hospital, one of the things the C-suite's always going to ask is surgery volume because that's where they make their money. They're not making their money in the ED because a lot of those people aren't insured. So they're just throwing money out the door. It sounds really bad because those are human lives. But from a business perspective, it's a tough place. And it depends, obviously, but in downtown areas, you're going to have a lot of homeless people in the ED.
Mm.
And you're not getting paid on any of those unless you get them enrolled in Medicaid, and then you're really getting pennies on the dollar.
Right.
Um, but I think if you start to break up large health insurance companies, you'll start to see maybe new payers come into place because I think insurance has a place in the market, but payers that incentivize quality rather than, I don't want to say quantity, but maybe a quick fix. So you'll start to see, value-based payers come in and say, hey, if, oh, this is a current actual value-based reimbursement model that is in place, is they have a 90-day readmission policy. And so the hospital's incentivized not to allow that patient, or maybe not allow is not the right word, but prevent the patient from coming back into the hospital for 90 days because the insurance company is not going to reimburse that claim. They're going to deny it if they were in for a treatment and 90 days later they're back in the hospital, unless there's, exceptions and things like that. That's something, unrelated to the reason why they were in the hospital originally happened. Um, but yeah, I mean, I think that's gonna, you would really have to break up the private insurers, and then you'd probably have to have some level of government intervention because hospitals are not in a good place right now. They're struggling, especially rural medicine.
Talk to me more about rural medicine and why that's struggling so bad, and how you think maybe a different structure could possibly improve it.
Well, I think hospitals operate on a really thin margin already, which I think is, when people say healthcare, you think of like these people riding around in Rolls Royces, but really and don't get me wrong, you can make good money in healthcare. That's not what I'm saying. But the people riding around in Rolls Royces are the insurers. They're the ones making 60% profit margin, 50% profit margin. Hospitals are making, like, I think one of the larger hospital systems posted a 13% last year. The average operating income of hospitals last year was negative. So hospitals are losing money
The average operating
and
income was negative.
negative. You know, yeah. And so, like anything, you can kind of beat things with volume. So if you have a big hospital, you're seeing a lot of patients, a lot of surgeries. There's a lot of doctors that live there that can provide expensive services. Rural medicine doesn't have that. There's not very many cardiothoracic surgeons or orthopedic surgeons that want to go live in Timbuktu. They want to live in Dallas. They want to live in Austin. They want to live in Houston, San Antonio. So you have these. So there's a variety of factors that um, make rural medicine very difficult. Also, generally, rural communities are low income. So in Dallas, they call it payer mix. So what percent of your patients are insured versus who's not insured? And with the insured, they'll break it down by payer because each hospital has a contractual rate with each of those payers. Um, but in a rural healthcare system, you may have not very many people that are insured. I don't know the exact percentages. I've never worked in real rural medicine, but you know, they're going bankrupt all the time.
It's just not worth I mean, from a financial standpoint, it's not worth the money to that you're probably going to lose to have a extensive network in a rural community.
Well, yeah, and I think like something I learned in my healthcare MBA was a term called no margin, no mission, and that came from a nonprofit hospital CEO. And the reason that is because nonprofits still have to at least break even. If they're going negative all of the time, they're relying on donors and or government grants, which we're seeing play out right now in academic healthcare systems where they they're not going to be able to continue some of the things that they're doing because they're not getting federal funding anymore because they're not profitable. And so you have to keep the door open.
Hmm. How does value based paying or value based payers, how does that help the situation? Because it would seem like, and this is where your knowledge on this is going to help me a lot. It would seem to me like the value based payers wouldn't, it'd be even less financially viable for them to
I
come
don't
in.
think and I think that's the big debate
Hmm.
is value-based medicine is great for the patient, not so good for the current healthcare system.
Oh,
And
so when
that's
you're
when
when your
you're trying to fit
baseline,
a round peg in a square hole.
yeah, when your baseline is the current system, something like a value-based system looks absolutely terrible because the current system is based on like profit margins and all these things. You don't care about the outcomes that much. Is that what you're kind of talking about?
Um, well, I think it would just require more cost from the hospital's perspective too, because it's already difficult enough to track all of our claims with the current system, which is generally straightforward compared to value-based healthcare, because value-based healthcare has all these specific metrics that you have to meet to get paid $100. So let's say I have a contract with you that says if I go to the gym 3 times a day, if I eat salad 2 times a week, which that will not happen, um, you know, if I walk 10,000 steps a day, you know, if I watch 2 movies, I don't know.
Mm-hmm.
You have all these different um, breakdowns, and each of those is like, if you complete this, you'll get $15. If you complete this, you'll get $12. If you complete this, you'll get $4. And so it gets even more complicated from a revenue cycle perspective to implement value-based care.
Wow.
So
Okay.
from a financial perspective, value-based care is extremely challenging. From a patient outcome, American health question, it's very, very good because now the hospitals are incentivized for you to be healthy, not for you to come back, as long as it's outside of the 90-day window.
Yeah. So, how how is a governmentally funded, like in like Canada, UK, like socialized healthcare to an extent? How is that any better? Because like, from a financial standpoint, it would seem like those systems would be just as incentivized to keep the doors open, even make a profit. I guess maybe they're less incentivized to make as high of a profit because to be able to meet your expenses and like but you're taxing the people. Talk me through that. I don't see how it's that much better for it to be a socialized system.
To me, I don't know that it is because, it's really funny you bring this up because I went to Costa Rica during my MBA for, a I don't even know if you want to call it a study abroad. It was 2 weeks, but we'll call it a study abroad. And Costa Rica has national health care. So I'll go for the benefits first because I think they're cool.
Mm-hmm.
One benefit is they have a universal EHR, which is something we haven't talked about. Um, so they have the same health record from birth to death. So, and it's on an app on their phone, which is so cool. And so, say you're in Spain, you're from Costa Rica, you're a Costa Rican citizen, and you have to go to the hospital. Instead of you having to say, "Oh, I'm allergic to XYZ, I've had this surgery, etc." Having explained this while you're probably in pain, there is your entire life documented. So I can see your skepticism in your eyes,
Well, it's
but we'll get there.
yeah, yeah,
We'll
yeah.
get
You
there.
keep
I
going. You keep
think
going.
from
We'll
a
talk about each of these points.
functional perspective, it's very cool.
Mhm.
It's very cool. And that is something the United States cannot do today. It's a term called interoperability, where they're trying to get EHRs to talk to each other because one health system may have one EHR, another health system may have a different one, but you may go to both. And so then it's on the patient to communicate what Dr. X did and communicate that to Dr. Y if they're in a different health system, different EHR. They don't communicate. Some do, but a lot don't. Another cool thing about the Costa Rican healthcare system is they have local clinics all throughout Costa Rica. And what's really cool about this is it's essentially what you would see as like a neighborhood urgent care. The difference is they have a pharmacy on site. And the thing that I thought like really pins a huge difference is, and this may be American culture, this may be the system. I'll leave that up for you to decide. But for example, if you miss a visit at your local clinic, they will ride a motorcycle to your house, knock on the door, and make sure you're okay.
Wow.
And so I think for a variety of reasons, that is a lot different than what we'd see in the US. Um, Maybe that's we don't care about each other that much. It's possible. Um, Maybe it's I live in an apartment complex. I have no idea who my neighbors are.
Hmm.
Maybe that could be part of it. But maybe it's because the people that are working in healthcare knew going into it that they're not going to be driving the Lamborghini like you see some physicians doing in the United States because that's not how they're compensated. They're doing it because they love people. So I think there's a variety of things beyond just national healthcare
Mhm.
that um, make Costa Rica really cool, but I think we can learn from them.
Hmm. Yeah, the Costa Rica example is really interesting. I haven't. No one ever uses that example, and I wonder if there could be a lot of reasons for why it's not given as a typical example in the argument for us as more
Well,
socialized type healthcare. I don't know if you've like thought about what those reasons might be or
yeah.
not, but
So, I mean, it was really cool. In this program, we got to actually talk to the guy who founded the Dr. Fauci, if you will, of uh, Costa Rican healthcare. And so the origins of it, and fact check me on this too, but there was a struggle between if Costa Rica wanted to be a democracy or a communist state. But the one thing the two agreed upon was they need national health care because the country is not have enough disposable income for them to be healthy. That's interesting though because they have what they call a blue zone there, which has the longest expectancy. I think there's several throughout the world. Costa Rica has one of them.
it's
A
Costa
lot of
Rica,
reasons for that.
Japan, lots of places.
Yeah,
I say lots, not a
happen
lot.
to be by coastlines.
Hmm.
Eat a lot of fish, a lot of vegetables, a lot of fruit. They're not eating cheeseburgers like us.
Yeah, they're not eating the standard American diet.
Yeah. Oh, what is that? We don't know yet. The standard American diet is wild, which I'm guilty of. But when we got to talk to him, it was so interesting because I think they just have a different perspective on the world than we do. That's what it comes down to. And they view healthcare as a right for their people, something they have to provide. And I think the United States views it as a way to make money, unfortunately.
Hmm. Hmm. Yeah, and talking to a lot of people, just friends and people that I know, it seems like that is not a common, like strictly the opinion that people hold about the healthcare system, right? I think most people think of going to the doctor as a thing that, you do whenever you need care. And so it's interesting because, well, I don't know. I don't know why, I don't want to necessarily assign a reason why, but that despite that not seeming to be a very commonly held opinion that yeah we should make money on our healthcare system, it is pretty universal. And like you said earlier, it's a lot of it is gigantic structures that are difficult to move, difficult to change because they've been around for so long. But how do you think we got to this point? I mean, starting one of those things, starting an insurance company, Blue Cross Blue Shield of Texas, and the after World War II, how does that progress to the point where we're at now? How is that allowed to happen to that extent? Because I don't know, but I have a very good feeling that it didn't start off like it is right now.
No. And I mean, truthfully, I don't know the answer to that,
Mm-hmm.
but I'll give it a shot of what I might think.
Yeah, we'll postulate.
Yeah, why not? Um, I think a big part of it is um, one is prestige, which is kind of interesting to think about. Doctors are held very, very highly. And I think when you have prestige, you often want a lot of money. And when you're providing a real value to people, you want to get paid for that. And I think that's fair. Like I'm not a person that says, you know, my brother would have a different opinion. Uh,
Your brother, the
you should have my
doctor.
you should have my brother on this. He would really, he's an interesting guy. We disagree a lot, but I love him. Um, but I think also like when so many ancillary people, as in business people, are making so much money, you kind of forget. I think money can be blinding. So, but I also think the last point I'll make, and this is just, I'm thinking out loud, is I think when something gets really established and people get comfortable with it, they just accept it for what it is. And it only gets to a point where we're at now that people are really pushing back. They're like, hold on, this has been going on for a long time. There's data supporting of how bad American health is. And now we want to do something about it, but we waited so long that it's going to be really, really, really hard.
So people being used to something that they're not even aware that it's bad. Seems like maybe, like you said, nowadays people are kind of coming back and realizing maybe it's bad. But it sounds like there's a bit of like an emotional problem here, almost with maybe some of the way our society's set up in general. At the very least, some of our
Mhm.
businesses. I mean, is there a level of apathy here? Talk to me about apathy.
Yeah, definitely. I mean, I think, and I'm guilty of it for sure, is, we all have our struggles, right? But generally speaking, we're pretty well taken care of. You know, there's plenty of ways to make money in the US, and there's a lot of things going in our favor. Even though, like, current times, it's pretty uncertain. I think for the most part, in America's worst day, we're better than most of the world.
Yeah.
And I think people forget that too, especially in the media and with people dramatizing the current state of things, which is not great, I will say. However, I think people need to remember like America's worst day is still pretty damn good. Um, so I think that causes not only myself but a lot of other Americans to kind of just turn a blind eye to a lot of the problems that we have in the world. And I mentioned my brother earlier. This is an ongoing conversation him and I have about things. And we don't necessarily agree, but I think I do learn a lot from him. It's kind of when two uh, contradicting opinions come together. You kind of miss each other, but you both learn. You're like, we don't agree, but like I could probably take something with that.
You kind of brush shoulders in the hallway. It's like, ah, okay.
Yeah, but you're like, oh, he's a cool guy.
Yeah.
Um, no, but in all seriousness, like I think that's also something we've lost that makes us very apathetic or very close-minded is also another way to think about it. Um, to other people's opinions.
Hmm. Like not looking for someone else's opinion to maybe be right, but just that they are the enemy. They are against you, and they can't possibly be right about something.
Yeah, that's no good. I mean, I obviously have my own opinions, but at the end of the day, I don't know if my opinion's any more valuable than anybody else's. And so I think Americans in general have lost that. They're like, oh, you're a Democrat. Oh, you're a Republican. We're not going to agree. And I don't think, and maybe it's just the loud voices that are like that. Because I think the general person you meet on the street, you can have a conversation with. And I think that needs to be talked about more.
Yeah, I think your typical person doesn't have the vitriol inside of them that maybe
No.
you see on X or whatever. That's going to be the trending thing, because the thing that gets the most views is going to be the thing that either makes you the most excited and like thrilled to see, or the most angry and upset to see.
Yeah.
And so like the
And the person on the,
sensationalism, well, yeah, the sensationalism of journalism, of social media, all of these things, because we have a click-based, internet culture where it matters less and less what you're writing about, and that you're writing something that will be seen. And so I wonder, talk me through maybe some of the role you think social media has played in what you're talking about here.
Oh, well, it makes a few people really loud. And, for better or for worse, we all agree with people and disagree with others. But, you know, I'm generally a right leaning individual, but that doesn't necessarily mean that I agree with everything Joe Rogan says. And I think that, I know, offensive. I hope he doesn't hear this. Uh, but yeah, I think, if you talk to someone on the left, they automatically go say, "Well, you listen to Joe Rogan." It's like, yeah, but doesn't mean I agree with everything he says.
Mm.
And so I think social media has given a lot of people a platform that doesn't encapsulate the whole story, if that makes sense. Because neutral opinions are pretty lame. Like they don't yield a very exciting conversation when you're both like, yeah, I can see your perspective. Yeah, I can see yours too. We don't agree with each other, but that's okay. I mean, the conversation would be like 15 minutes. So, it's actually interesting. I saw a podcast from a very polarizing individual recently,
Hmm.
none other than Tucker Carlson.
Mm.
But he interviewed the founder of Ben and Jerry's, which is notoriously left wing. I think I actually saw something the other day that he got kicked out of something for standing up and yelling at RFKs, um, something to Congress. I'm not a big government guy, track it very well, but they're very different people, and you can tell that in the conversation. Uh, but they had really good conversation. And like I could tell Tucker Carlson was actually like, you could hear him. I mean, he said like, we don't believe the same things, but I don't think you're wrong about this. And I think that one was really cool. It stood out to me as a good one.
It's been cool to see. I mean, Tucker Carlson specifically, at least, as somebody who was viewed so much as, in this one bucket of who he is, what he thinks, what he believes, and how he communicates that. Seeing him,
Mm-hmm.
kind of be a little independent now, and the way he's able to express his views. It's like obviously, his opinions haven't changed a ton, but the way he's able to communicate those, the people he's able to talk to, I mean, it's been really, I mean, in some ways inspiring that, someone with nuance in their opinions has been allowed to express them in a very big forum.
Yeah.
I think that's a reason why Rogan does so well is because he holds some very stereotypically conflicting opinions at the same time. It's very he's call him macho man if you want. He's absolutely jacked. He's talked about his performance enhancement that he does. He works out every single day, all this stuff. But then also like he supports abortion. Those two things rarely ever go together. And then you add in the fact that he's very pro-gun, and all of these things like it's these things that you would never on the internet expect to go together, yet
Mm-hmm.
he's got these reasons for everything. It's not just like he's handpicking opinions to have. And I think that's a really important thing that to get back into the zeitgeist, get back into the conversation, is having actually nuanced opinions about things, having legitimate thoughts behind what you say, not just I heard a talking point on the internet and I'm going to repeat that and shout at people who disagree with me. I think people
Yeah.
like that, and it's something that I want to try and do here is elaborate on nuance, the actual
Mm-hmm.
very subtle differences between things. And you might agree with somebody 99% on something, but like what is that 1%, and why is it there? It's like it doesn't
Yeah.
have to be the end of the world. It can just be like kind of like you said with your brother brushing shoulders in the hallway. Is like what's that 1% where that overlap kind of grinds a little bit. And maybe there's something to be learned from these very slight differences that you might have. That's what I find so interesting. And
Yeah.
so to turn it a little bit to like the apathy thing, or the closed mindedness, like the lack of empathy, right? That would be what apathy, I guess, is. Why do you think people are so prone to not seeing other people as almost human?
You're asking me questions that are very difficult.
Hey man,
I
hey,
don't know.
we're gonna talk about some difficult stuff, and then we're gonna have a little bit of fun, right? I want
I
this to
don't
be
claim to
interesting.
be. I don't claim to be an expert. I can only speak
No,
on my own experience.
no, we're not
Um,
experts. We're not experts at all,
no,
and I don't
we're
think
just two
anyone can
guys.
be. I don't think anyone can be an expert on apathy or empathy. I mean, you can maybe do some research on it and know the neural pathways in these things, but I think that as a human, existing as a human, like you were created by God and you have emotions, right? Because of
Mhm.
that, you are some level of expert on emotions. Now maybe you don't have a good hold of your emotions. Maybe you're learning about how to handle these things, but you experience that every single day, and so you know what it's about. You know what's going on, and so to that extent, I mean, I am curious what you think about why people have become so apathetic and lack empathy for other humans.
I think most of the time we're just stuck in our phones or on Netflix, or so we aren't really experiencing the world that maybe even our parents did. That, you know, we feel like we've experienced the world because we can see any part of it with the search, but we haven't actually been there. And I going back to the first time I left the country was actually for that trip in Costa Rica, and I felt like I knew about the world. I learned right when I got there that I knew things about the world. I knew facts, and I maybe have watched one too many documentaries in my life, but I didn't actually know the world, and I still don't. And I think that's probably something that people your age and my age, and maybe you can talk to maybe if you relate to this, but you feel like you understand maybe something that you've never experienced,
Hmm.
but you really don't. And then you feel like your learning is done. And then you're like, oh, I'm gonna pick and choose what I want to learn about now. And like that hard thing that's difficult to wrap your mind around, I'll just switch off of it after I get done with this reel and move to something that's more comfortable for me to think about while I'm sitting in my really comfy couch with my PJs and house slippers on,
I
which is
think.
something I'm super guilty of. But I'd like to hear your opinion on it too.
Well, I think you just hit on like half a dozen massively interesting topics in themselves. I mean, talking about comfort zones, talking about, um, I mean, comfort zones in itself. That's such a um, such an interesting topic, right? It's like how do you like, where how do you define what your comfort zone is? How do you know, and how do you push those boundaries, right? How do you grow as a person? And then you're talking about, determining that your learning is done. What a deep concept! Like you think you know about the world. I think to some extent, maybe to kind of address your question a little bit. If I think I agree to some extent. I think that the way you started off your description was actually describing empathy, like eh, having an understanding of something you haven't experienced. I mean, that is empathy, right? It's having an emotional connection to something outside of yourself, which is probably not a dictionary definition, but an approximate one.
I'll
Um,
take it.
but like, I mean, that's how you started off what you were saying. It's like that actually is empathy, but then the very quick follow up with, and then you think your learning is done. I think that is a very key part of this, where you see, like you said, a few reels or a couple of tweets, or maybe you maybe even read an
Mm.
article, heaven forbid.
Whoa.
But you do this tiny little bit of information gathering, and it seems like instead of inspiring more research, you, there seems to be a tendency of people to stop. and assume, okay, that's it. And maybe that's an attention span
Mm-hmm.
thing. Maybe that's just maybe we do have a more increased innate lack of caring. I don't know. We can speculate there, but I think attention span is a huge thing. And, you get to this point where, like I said, instead of inspiring more research to be done, you just, like you said, you're done. And okay, I've now read 2 articles on what the Costa Rica healthcare system is like,
Or
and
one podcast.
yeah. Or I've listened to somebody for 3 hours, which is like most of my day, and therefore now I know all I need to know about this one thing, and I can go and talk about
Mhm.
it as if I'm an expert. And then you move on to the next thing. You move on to the next distraction. You get back to your comfort zone where you're not learning something new. You're not pushing yourself to try a different thing. And I think you're hitting the nail on the head with that. That is the endemic problem that we have, where people don't know how to push their comfort zones, that likely are scared to. I think we have a society of very scared people. And what that comes from is probably a different discussion. Because, I mean, the myriad of factors with parenting, government, the world is very connected. And so there's a lot to see, a lot of good things to see, a lot of beautiful
Mhm.
things to see, a lot of really cool things to learn. You just imagine how easy it is to learn a language today than it was 50 years ago. But then at the same time, you have a lot of really gnarly things to see. Like, I mean, I remember a time, I've fortunately kind of flushed it out now somehow, but I remember a time where my feed, it was not uncommon to see a beheading pop up.
Yeah.
And
I've seen them too.
there's plenty of those videos.
Or like
And
real, like something that I've been seeing recently is like real war, like
dude,
in Ukraine, where you're
footage
like,
of war. Yes.
yeah,
Like,
and it was revolutionary to get World War II film in color.
mm-hmm.
Like maybe when I was young, like I remember watching documentaries and being like, whoa, like because when it's black and white to people like us, it's like it didn't even happen. It's literally like a movie. So I think you're right.
There's this level of, well, and actually there's a bit of an interesting little, U curve here, like an inverse bell curve where, if when the film was in black and white whenever we were younger and like they finally got color is crazy, but seeing it in black and white, you can kind of dissociate a little bit from it. Like,
Oh yeah.
like you don't really think it happened, like you said. And then there's this kind of uncanny valley almost where we're talking about trending videos and the loud voices, and it seems like everybody on the left thinks like this and everybody on the right thinks like this. And so we're like, now the things you're seeing that are like a record, a recording of a very small part of something, you're seeing that as all of reality. So you've disassociated on over here on the left, and then we have this dip where now you're associating directly, permanently, purposefully, maybe not permanently, with something as reality. But then you think with social media as well, kind of the other side of it, where we're now disassociated from human connection. And you see another person and don't even think of them as a person. I mean, I'm guilty of this driving. I mean, I think anyone who hasn't had road
Houston will do it
rage,
to you.
Houston will do it to you. Amen, brother. But like, I mean, listen, if somebody out there has never ever once had a little bit of anger boil up whenever they're driving,
Hop on Westheimer, baby.
it's just come visit H Town. Like, goodness gracious,
It'll be
I-10,
hot and miserable.
Interstate 10 in really any time of day, but during rush hour, that'll make your blood boil. It's so hot. So I mean, but realistically though, like you have this thing where you disassociate, like this kind of return to disassociating, where now instead of it being a dissociation from a past event, like you kind of aren't really understanding that this brutal war happened because the footage is in black and white. You're disassociating from the people around you right now because you have this constant feed of what, like these perfect things, perfect lives on social media, with these totally flushed out stereotypes that exist. You don't have to think about anything. It's this weird kind of, U curve of this dissociation and strong association with things.
Mm-hmm. Yeah. I'm curious when people are going to get tired of it. Because I think there's a time coming where people are tired of not experiencing life for themselves. I think we're starting to see it a little bit.
Yeah, say more.
But I think that it might not be our generation, but it might be our kids when there's because you can either go two directions. Like one direction would be they're gonna literally live in VR. Like they're not going to be here. Everybody's gonna be wearing goggles, which is a possibility. But the alternative would be people start to live their lives differently because people have gotten so emotionally unhealthy that they want to choose something else. I think that's going to be really interesting to see, like,
They've
in our
almost
kids'
been
lives.
pushed so far to the right of the curve that they're ready to kind of wrap back
They're
around.
off the cliff.
Yeah.
It's either off the cliff or turn around.
What an interesting concept. Yeah. I tend to be very hopeful, especially about that kind of thing.
I'm hopeful too.
Yeah, I think.
Go ahead.
Well, no, I was just thinking. I tend to be very hopeful about that kind of thing, where it seems like more and more people are taking, at the very least, very small steps, like deleting social medias, like putting time restrictions on their phone. There's like these devices that exist now where you have to go into like a different room to be able to have access to your phone. Like all these different things where I think people are more and more open to this being rid of technology to an extent, where they're like trying. I think we're trying to find this healthy balance. I say we. I don't know who the we is, but I think a lot of people are realizing what you're saying, and to me, that's cool. I think it's a very hopeful perspective. I have it. Now, I mean, if we all end up where our brains just get uploaded into a computer someday, so be it.
We're screwed.
Yeah, I mean, if that's the direction we're headed, then we're screwed anyway. So you might as well try and enjoy the human part of it anyway. So I think both arguments kind of wrap around to the enjoy what you have while you're here kind of thing, which is, I mean, such a hopeful message anyway. It's like, it's so good.
You might as well have fun.
You might as well have fun.
I said that today at work. I was like, if I'm going to be here, I might as well have fun. Like, I'm not going to sit here and be miserable. Like, that's so boring. I'm just not going to do it.
I mean, I heard this idea, I think from Alex Hormozy, who you may have heard of. Is
he the guy that buff, wears a backward hat?
Yeah, absolutely jacked. 99% of the time in a tank top and or a flannel.
Yep.
Yeah, this idea of if you can be in a bad mood for no reason, you can be in a good mood for no reason.
Mm-hmm.
Because there's no reason.
Yeah.
So just do it. Like why have something suck for no reason when it could not suck for no reason? It's like, dang it. And I've heard it a few times now. This is one of the good things I've gotten from Reels. I've heard it a few times now, and it's like I'll just be, pissing around, just being mad about nothing, or mad about something from like hours and hours or days ago. And I'm like, this is so stupid. Like, I'm making my life suck right now for no reason. It's like, you know what? I'm just gonna like kind of try and stop. And it's so hard. But like that idea of just having more play, it's an idea I've been trying to like play around with in general, like at work, at home, just finding the enjoyment as much as possible in whatever it is I'm doing, even if it's like fairly mundane. If I'm writing an email, It's like, okay, I'm writing an email to somebody. Huh?
There was a guy that I used to work with that would start every email with a riddle.
Oh.
And it was like, at first, it was like, I'm like, this guy's lame. But then I started to enjoy it. And I was like, dude, this guy's sending me like spreadsheets. It's so boring. But I'm more interested in the riddle, and I'll get to the spreadsheet.
Yes. I mean, stuff like that. It's like, first, I mean, maybe he's getting you looped in so that you're gonna open the spreadsheet or whatever. But like, you get a little excited for that, right? Because he's having a little bit of fun in this super boring thing he's sending you. It's like, okay, if I'm
Yeah.
sending a super basic email, like I need a quote for something from somebody, it's like, okay, I could make this the most boring, simple email in the world where I say, hi, please provide whatever. Or like I could put a little exclamation point, or like I could put a smiley face at the end and say thank you instead of
Oh
regards.
no,
You know,
a smiley
I know,
face.
how
You
dare me, so
couldn't.
unprofessional. But like it's finding those little things that just that's not going to change the outcome in a negative way. It's not gonna. They're not gonna not
No.
reply to the email. If it's gonna be neutral or it's gonna be positive. It's like finding those things, as in as much of life as possible. I think is a pretty healthy mindset. And then on the
Yeah.
flip side, being able to buckle down and like say, all right, I gotta focus on this thing. It's not going to be that fun, and I understand that. Balancing those two things seems like a really healthy way to approach life.
Yeah. I've been learning something in therapy that I want you to think about it. And I want you to call me. And maybe it's later in the week.
Mm-hmm.
Well, it's Thursday.
Maybe
Um
it's next week.
Thursday, right? Maybe it's next week. But I've been starting to think about my emotions like they're 3D. Because I think oftentimes I view my emotions as 2D. And if I'm mad, I'm mad. There's only one way to look at it. Or if I'm frustrated, I'm frustrated. Or if I'm sad, I'm sad. You get the point.
Mm-hmm.
Um, but something I've been trying to do is like flip my emotions around, kind of like a kid playing with a toy, and like really start to think about what I'm feeling. I think oftentimes when we feel an emotion, we jump to this is what it is. And I don't know, for me at least, I don't know what I'm supposed to do with that other than feel it. But when you start to be curious about it and you start to flip it upside down, look on top, look around it, kind of be curious about it, I think you start to see a different perspective. I have seen a different perspective. So you let me know what you think about that.
Yeah, what a concept. Thinking. So is this thinking of them in 3D versus 2D metaphorically? I'm assuming, right? Like you're not.
Yes.
Okay. Well, I mean, I don't know. Like I didn't know if there was some extra layer I was missing in that.
No, no, you got it.
That's okay. That is. I will be calling you later this week or sometime next week with that. That's really cool. I'm gonna chew on that. Huh.
It helps when you're feeling an emotion too to think about it that way. And I think one of the things it does is it makes you pause and think. Because if you just view it as for like it is what it is, and that like there's no changing it or no looking at it in a different way, you just react. You don't you don't ponder. But when you feel something, you're like, hold on, like I'm feeling this. It's okay, I'm feeling it. But what perspective am I going to choose to look at it from? Am I going to look at it from top down? Am I going bottom up? Am I going to look at it from the side, at an angle? How am I going to view this emotion other than, you know, I'm mad? Just like caveman style it.
Tell me a little more about that. I mean, maybe if you have any examples that you're comfortable sharing, or a way to think about it, where because I get it, I think, but I don't know if you can like kind of give an example of like if you're
Yeah, I'll
angry at
share
something or
one example.
frustrated, that would be good.
So I'm married, and the past few months have been not the easiest, and I'm not going to overshare, but um, I had to start really thinking about why I was feeling certain things in my marriage. And my wife had been gone a lot. There was a lot of me and my dog, as lame as that sounds. A lot of video games, a lot of scrolling, and then I would get really frustrated. And I would just be frustrated. I'd just be mad. And my wife would come to me and say, "Why are you upset?" And I didn't know. I was just like, "I don't know. I'm just feeling this way." And so I started to go to therapy. And I told he was like, "What are your goals?" Get the whole shrink spill. And I was like, I honestly just want to understand why I feel certain ways. because I never thought about it. It was always like managing how I felt. Like I shouldn't feel that way. But he was like, no, like your feelings are your feelings. They are what they are. You're not going to change them. They're physiological response. So that's what it's going to be. But it's your choice how you view it. And he actually never told me about the 3D thing. It's something that I kind of brought to him. I was like, what do you think about this? He was like, that's really cool. And I was like, that's my smart man moment. That's a pat on the back. Um, but then I realized I was feeling lonely. And like it seemed so obvious. But when I didn't think about it intently, or maybe viewed it as a 2D object, all I could express is I was frustrated. But I didn't twist it around and look at it and really analyze it and think about, okay, why am I actually feeling this way? I was just saying I am this way.
Mm.
And so that's an example without that's probably super vague, but you get the point. But like I was expressing that I was frustrated. I was physically frustrated. You know, people could hear in my tone of voice that I was frustrated, but I could never explain why. And so that's how I kind of started thinking about it that way.
Yeah, I think that relational struggles are absolutely relatable. I think it's a good example, and I think a lot of people will maybe not know, specifically exactly what you're talking about, but they know what you're talking about, right? Or
Well,
their
I think
their
everybody's
version,
been lonely.
like their version of whatever you're talking about. It may not be the same circumstances, but they have the same feeling. And what an
Yeah.
interesting concept of taking, like, you take your frustration that you feel, but you just turn it around, you pick it up, and like on the backside of that frustration is loneliness, like
Yeah.
separation from this person that you love. And I think that's, yeah, I'm gonna have to chew on that. I have to like jot some ideas down because
Yeah.
I mean in a lot of ways that's a beautiful way to think about it, because there are just so many different, like, different perspectives to take on that.
Yeah.
Um,
The last thing I'll say about it too is frustration is not actionable. Loneliness is actionable. Like when you're lonely, you can go be with people. Like you can make a choice to go do something about it. When you're frustrated, what are you going to, I mean, you could go punch a bag if you wanted to. I guess that would be your action, or go do something that lets out your anger. That I guess you could view that as actionable. But generally speaking, I would say that's not very healthy. Uh, I mean, it might be in certain circumstances, punch the pillow, not your dog.
Never the dog.
Um,
Never the dog. So I mean, I think like you're
okay.
saying with loneliness, little little something happened down outside there, so had to go make sure everything was okay. Everything's okay. But talking about like loneliness like that, you were saying that like loneliness, like you can kind of do something about that. Kind of say more about what you were saying
hmm
there.
Well, I think it's just it's actionable, and you can act on it upon in healthy ways. And I'm not saying that like to me, the way I was, um, if I was frustrated, the way I would make it actionable were very unhealthy. Um, but with loneliness, I could take an action that enhanced my life. If my wife was busy, I could hang out with friends. I could go golfing. I could go, I could do whatever because I'm not mad, I'm not frustrated. I'm I'm feeling a different emotion. And if I hold it in, then I get frustrated. But if I go do something that I enjoy with other people, preferably, it's kind of relieved. Is it
Mm.
the same? No, obviously. Hanging out with you is not the same as hanging out with my wife. Hate to break it to you, Austin. However, um, it's a dose, right?
Mm. Yeah, I
So I don't
wonder.
know if that makes sense.
No, it does make sense a lot. And it's like, you're taking this emotion that's hard to describe and looking at it from a slightly different angle and finding a subsection of it that's a little bit easier to describe and has a
hmm
pretty has a solution, right? Like you're just taking a slightly different perspective, which I mean probably helps, you know, dissuade the negative emotions in general. Just a better perspective on it. I do. I wonder how much of that. I'm not saying that what you're doing is wrong or bad, but I'm just curious, like how much of helping the frustration with those things, those social things, is because that frustration comes from loneliness specifically, or if it's doing something social is just really good for you. To I mean, obviously you're pretty extroverted, but I think even for an introvert, having human connection is highly important. I wonder how much of it comes from that versus like what you're actually feeling as loneliness versus some combination of all of that. I wonder where the
Yeah,
balance is there.
I would say both and.
Mm.
Like you're not. I don't think it's one thing. Um, I think it's a combination. I think you're right.
Yeah, that's a good one though. The emotions in 3D is really cool, and like to hear that like you're in therapy to help with these things. I mean, would you suggest therapy to people that are going through something like that?
Yeah, a good one. Bad therapist will ruin your day. Um, but yeah, for sure. I think you just have to be willing because, like, for example, like I've gone to therapy several times, and with this time, I was with one therapist, and just wasn't my gal.
Mm.
Just it didn't go poorly. It wasn't bad, but it just wasn't the right fit. And so I could have either given up and said therapy's not for me because I had one experience and it was bland, or I could try again. And so I got with a new guy and it's been great. So I think you have to be willing. And if you're willing, it's going to be a good thing if you get the right person. But you can't just be like, I went to one shrink and it sucked. So therapy in general sucks. It's bad perspective. It's
Mm.
bad perspective.
What would be your quick tips to find a good therapist?
I think a lot of people, and maybe this is just me, so maybe not a lot of people, let other people figure that out. But I would just click someone, like whatever, you know. But most therapy sites, they have their specialty and or things that they focus on, just like anybody else. You you have. I wouldn't go talk to you about, I don't know, whales because your focus is engineering. I wouldn't, it's just, but I think the the tendency is to just pick someone and go, which can work, just wing it. But often, like I think with the second go around, I really looked at what I was looking for, kind of like, I don't know, this sounds really stupid, but like a dating app. You're not just gonna pick a random person and hope it goes well. You might, more power to you, but you try to find some level of commonality. So I think just being patient and thinking about it like that might help.
That's great. Well, I got one last thing for you that I'm curious about.
Yeah.
I'm wondering what what's something you've learned maybe in the past 6 months, maybe outside of therapy, something you've read or listened to that's really changed part of the way you think.
Oh. Oh. I've been listening to Extreme Ownership with Jocko and Leif Babin. And by the way, Leif Babin, if you ever hear this podcast, your voice is awesome.
Stephen Davis certified, awesome
Yeah,
voice.
yeah. Like, nice voice, man. Um, but I think it kind of goes in parallel with the stuff I was talking about with therapy is you can only control the controllable. And I think with them and what they're saying is if you don't take ownership for your piece of the pie, maybe it's the whole piece, which Jocko would allude to in like chapter one, where there was like a blue on blue friendly fire situation. And he like went around the room and was like, whose fault is this? And he was like, no, it's my fault. It's like kind of badass moment. So maybe it's the whole pie. But kind of taking personal accountability and being looking like, hey, I've been overweight for a couple years now, and I've been saying every excuse in the book of why that is. But ultimately, like, it's up to me. Like, if I want to change it, I should change it. And I think that book has been really cool. In that perspective. And then you also like the book's cool in itself because you get to listen to a bunch of like war stories. And I know they would probably hate me saying that out loud, but it is kind of cool. Like it's an entertaining piece. And then they relate it to business, which is like something I'm interested in. But at the same time, I've always found that books like that have more personal impact on me. Like they should change your person and your person should operate differently at work. So it's not just like I'm gonna change my work persona, but they should change you to where like you're a better communicator, not just at work but at home. Or like you take accountability, not just at work but at home. And so that's what I've always that's something I've been learning, uh, listening to.
Well, dude, I'm excited to see how you continue to grow like, through those mindsets and like the way that you're thinking and talking about this kind of stuff. It's super exciting to see. So, I mean, what's next for you? You know, in the next 6 months, year, what are you doing? What is life? What direction are you taking?
Yeah, it's busy. Life is in school, working hard, kicking ass. Um, so super proud of her. And then I took on a new role, so I'll be relocating in September. So there's going to be a lot of travel for me coming up. Um, but just gotta take it with a grain of salt. Realize it's short term, make it work, and choose to be happy. Quit no, don't focus on the negative. So I
There you
think
go.
there's a lot of really good things coming up.
That's
A lot of really
awesome.
good
I love
good
to hear
things.
that. Stephen Davis, everybody. I appreciate you coming on, man. This is really cool. Yeah, round of applause. But no, I really appreciate that. I think there's a lot of really cool nuggets in here that I'm definitely gonna go back and listen to. And just, I mean, you taught me a number of things today, and so I just really appreciate you talking to me and having this time. So appreciate it.
Of course, Austin Green, come on now.